Thank you. This amendment to the Alberta Research and Innovation Amendment Act 2016 states that the Alberta Research and Innovation Amendment Act 2016 be amended in Section 6 in the proposed Section 6.1, subsection 1, by striking out Clause B. This, I believe, will recognize the critical contribution of medical research, health research in this province for the last 20 years, and the way that that recognized entity under the Alberta Heritage Foundation for Medical Research and then Alberta Innovates Health Solutions has brought international researchers, international renown, huge investment to Alberta, and a recognition that we have a separate identity in research within the medical and health area that has brought more innovation dollars than any other and needs to be protected. If it's hidden under a single entity called Alberta Innovates, there's a real danger that there will be a loss not only of recognition of this as a research center, but indeed a loss in terms of the connection between health research and the health system. Currently under Alberta Health, Alberta Innovates Health Solutions is carrying out relevant research to the health system, improving efficiencies, improving connections, and making sure that the research that's being done can be translated into concrete improvements in our healthcare system, can translate into improved management processes, various aspects of health research that have really not only improved health in Alberta, but improved health delivery in Alberta, have not only saved lives in terms of new technologies and new drugs and new opportunities for Alberta and the world, but also contributed to market and business opportunities around the world. So it has been a generator of tremendous both new medical breakthroughs and businesses in Alberta, to put it in a nutshell. There is real concern in the research community since it was removed and put under the Alberta Innovates Health Solutions that it had lost some degree of integrity, some degree of credibility, and certainly this continues a trend towards uncertainty about our commitment to health research and medical research. And this sends an unfortunate message across the world if it's hidden under a general rubric of Alberta Innovates and doesn't have its own clear identity. So I would argue that if we're going to continue to be a source of attracting the best medical and health researchers on the planet, if we're going to continue to have the kind of reputation and investment opportunities from outside of the province, which we've enjoyed for many years, and it's my understanding that it's about a 2-to-1 investment. Alberta invests $1 and other provinces and other funding bodies invest $2 in Alberta medical research because of the very reputation and quality and outputs that we've had here over the last 25 years. I heard from both Deans Federick and Meddings, that is the Deans of University of Alberta and Calgary, about the tremendous concern that this second level of changing is having on the medical community. We are already concerned in these medical centers that top-notch students are not coming here. Dollars have started to go elsewhere in terms of investments in new research, and the teaching programs are losing momentum in some areas. So I think we have to think very carefully about whether health and medical research should be continue to have some autonomy outside of the Alberta Innovates organization. I would argue that that's very much the case. The new strategic clinical networks, for example, in the health system that have identified, for example, maternity care, and they have a separate research arm that's looking at maternity care and how that child and maternal care, how that can be improved. The areas of prevention and public health as a separate entity and the research needed in that to try and improve prevention programs, health promotion programs in the community. It's by no means certain that a single research body would be able to identify the priorities and allocate the funds in a way that would maintain the kind of momentum and credibility and international visibility that the name Alberta Innovates Health Solutions could, or some other name, whatever it be. So I'm arguing that we need to pluck out from this bill the Alberta Innovates Health Solutions and find a place for it, I would argue under health, but anywhere, including it could be a subset of Alberta Innovates, but it needs to have its own name. If the international community sees that Alberta does no longer have a health and a medical research name, and that all their resources are going into something called Alberta Innovates, there will be a tremendous loss of momentum in terms of our health and medical research. Thanks, Madam Chair.